Welcome, everyone. How is everyone doing today? Let's see, it's just 1 o'clock right now. So, welcome, everyone. Welcome. We'll wait a few more minutes till everyone joins in. Right now, we got about 50 people on the call. Hey, Danny, how you doing?
Hi, Kurt. Hello, everyone.
Hey there, Aaron. We'll just give it a few more minutes for people to join here. Hey there, Bobby. Good seeing you.
Hi, Kurt. How is everybody today? Everybody looks good. I like the smiles on the faces that I can see right now.
It's that magic sunshine, Bobby, after a day and a half of rain, but looking forward to a lower water bill next month. So I'm loving that. Loving that. All right. I'm going to say welcome, everyone. It is a 1:02. I like to keep the meetings prompt and moving as necessary. Just want to welcome and just remind everyone that this is our meeting as stakeholders and a lot of people involved in it. So great open forum opportunities to share your thoughts on things that maybe we want to talk about down the road. I would like to make sure we address things appropriately. Anyone wants to speak up, please feel free. We do try to follow a little protocol in either raising your hand or putting your name in the queue saying you'd like to talk. And we'll make sure you get heard. So supposed to be unintimidating and feel free to speak up on any subject. If it's not on the agenda, please kind of focus it to the open forums that we have. We'll discuss it. If we can solve them, great. But usually what we'll do is we'll add that information to make sure it's included in any future agenda. So with that, welcome again, everyone. And I'd like to just simply say, if you are on the phone, not calling in through Zoom, if you are on the phone, please make sure you give us your name or say you're here in the queue so we can record you for voting. All right. So anyone here on the phone who's not on the Zoom?
Renee Farmer.
Hey, Renee Farmer. Glad to hear you're with us. Anyone else? Okay. Well, with that said, if we don't have anything else going on, I'd like to introduce you to a new person that our new intern from working with the state, McKenna. Am I saying that name right, McKenna?
Yes.
Great. So McKenna's here to help assist us through the PDPPC here any way we can and kind of help coordinate things. So McKenna, I'll let you open up that new attendee poll for anyone else who is here new for the first time. That way we can log you in again. We do have a voting requirement. If anyone hasn't taken the time, I send that agenda out every month. There's actually about 4 pages on that. And near the bottom, we have some of our protocol we try to follow, as well as letting everyone know. Feel free to speak up. But if you could set up that poll, let's get started with that. Okay, McKenna?
Yep. Yeah, so I'm McKenna. I am a social work intern with the participant directed programs this year. I just launched the poll for new meeting attendees. So if you are online, you can find the poll located at the bottom of your screen, or under the more button that has 3 dots. This poll basically just helps us get to know you as a new stakeholder, and make sure that you're captured in attendance as well as the voting rights document. So I'll leave it open for a few minutes.
Outstanding. Yeah, so if any of you are new to this program, I know a lot of people are joining new. Please feel free to put your name in there as a poll. That way we can just kind of capture your information for you. So it makes it a little bit easier for voting down the road. So, all right. All right, we're really on time. It's working great here. Since we're on time, I'd love to open the floor up to open forum. Again, anyone who has any topic they want to talk to or about, raise your hand or put your name in the queue in the chat, and we'll make sure you can speak. So let's do that. Anyone who has any open items before we address a couple of the bullet points that we have, please raise your hand. Anything? I do not see any chats. Anyone have any topic for the open forum? And if we can't think of it, that's fine. We have a couple we'd like to talk to as well. So one of the things everyone may have seen is that next bullet point about this rate decrease. Okay, so Danny, if you're ready, let's talk about that new rate decrease that's coming up.
Yeah, thank you, Kurt. Hi, everyone. It's Danny Kraus with HICPUF. So I just wanted to announce, most of you hopefully are aware that there is a rate decrease, an across-the-board rate decrease occurring on October 1st of 2025. And so that's looks like about a month or a week away. So for CDAS, just wanted to inform everybody that updated allocation information should have been provided to you. We made a slight pivot this go around to make sure everybody could get noticed in time. And so you should have gotten that notification from your FMS provider. I believe FMS systems will also be capturing the new allocation amounts. I think Palco's is right around now, and PPLs should be showing up by the end of the week. And so that leads just to the second point. If you are a member with PPL, you may have already gotten an email about this, but just a reminder that their system will be down this weekend, the 27th through the 28th, while they're updating allocation information in the system. And so if you have any questions about that, PPL customer service is a great place to start. You should have received an email or a notice of some kind from PPL. And that is my update for CDAS rate decreases.
Hey, Danny, I have a quick question. This is Kurt.
Yeah.
Reserve funds from the past, that shouldn't change anything that's in reserve, right?
Correct. Yep. So reserve funds shouldn't be changing. If you had an allocation last month and it's higher than this month, that allocation amount is frozen. So there won't be any issues with like historical overspending. None of the previous allocation amounts are going to be impacted.
Okay. Anyone
Renee,
else?
I got a question. Renee,
Okay, Renee, you're next. Go ahead.
are we going to be receiving notices from our case managers?
This go around, the notice is coming from the FMS provider instead of the case manager. If you receive a change in service, so like if your case manager changed like the amount of hours that you were approved for, your case manager would definitely be notifying you. But for just the rate decrease itself, that allocation change notice is coming directly from the FMS provider.
So it'll just be whatever pops up, shows up on our accounts on the FMS's website.
Yeah, they should have provided a letter. So depending on what your preferred communication is with your FMS provider, they would either send you an email if your preferred is email, or if your preference is mail, they should have mailed the letter to you.
by when?
Letters were supposed to go out by the 20th. So if you have not heard yet, we can get connected with your FMS and figure out why you haven't gotten that.
Yeah, I have. Well, let me check. Let me check my email again to make sure. So, if not, who do I contact?
I cannot recall which FMS you work with, but I believe we have representatives from both FMS on the call. So I'm going to task FMSs. If your agency works with Renee, will you please reach out to her and make sure she gets her allocation amount?
And I just want to share that I know myself and I think Bobby and a few others, we got our notification of the decrease through the Department of Healthcare Policy and Finance. Now, I sign up for those notices, but it's straight across the board and basically said it's not a change in your hours, it's across the board decrease in rates. So that's why the FMS or the state are sending out that notification as opposed to the case manager.
Thanks, Kurt. And I'll just add some context. And Jose, I see your hands up too. So I'll get to you in just a sec. But I see a couple things in the chat too about this is the first people are hearing about it, and has this been talked about in other meetings? We might have made an update during the last PDPPC, but just for everybody's general awareness, this decision was made a very short time ago as a result of the executive order from Governor Polis. And so I will say, I think it was made less than a month ago. And so we've been working diligently to get information out as quickly and thoroughly as possible. We were able to get a memo updated and available. And I believe it looks like Aaron just put the link to that memo in the chat. And I'll get the memo number if there's anybody that's unable to view what's in the chat. So if you would like to review the memo, it's operational memo 25-062. And that outlines the CDAS rate change and the reasoning behind it in more detail.
I mean, I got a real quick comment. I saw that Aaron put that in the chat as well. One thing also, remember everyone, we did get an increase in July. And basically, this is removing that increase. I think is the best way to look at it. And if you follow the government or anything on the news, I believe the department and the state in general is behind $800 million. So this is part of their recovery to get back in budget. So just like to throw that out there. Any other comments or hands raised? I see a lot in the chat going on. Anyone who would like to speak up to this anymore?
I think Jose has his hand up.
Hey, Jose, go ahead.
Thank you. Danielle, you mentioned something per Kurt's question, and I'm not sure I understand. I just want you to clarify it for me. You said that pre-existing allocations are not being touched. What does that mean exactly?
Yeah, that's a good question. So for CDAS, as you know, Jose, you get your monthly allocation amount and you get a certain amount each month. And so the amount that you had access to prior to this rate decrease isn't changing. So for example, if your monthly allocation last month and 2 months ago was $1,000, and then with this rate decrease, it's changing to $900, which that's exaggerated. It won't decrease by 10%. But if it were to decrease by $900, your previous allocations would still be worth $1,000. So if you spend that $1,000, you're not going to get hit with overspending or anything. The decreased rate is only effective from 10/1 moving forward.
Gotcha. Now it makes sense. Thank you.
Great. Yeah, good question. That's a good one.
Awesome. Any other comments? Open forum still happening here regarding rate increases. I cannot see people's hands raised. So Dan, if you can help me with that for whatever reason.
Yeah, Got it. Stan had
Great.
his hand up too from PPL.
Okay, let's go, Stan.
Hey,
Nice
hi,
to
Kurt.
you,
How's it going?
Stan. Good,
See-
good. Good seeing you.
Yeah, excuse
What's
me.
up?
Thank you. Yeah, I was getting one. I heard Danny ask that if the FMS, so PBL, Renee Farmer is signed up with us, so I can reach out to Renee directly if she wants me to. If she can't find an email or any information, I will make sure she gets it.
Thank you, Stan.
This is Renee. That'd be great.
Okay, thank you.
All right. All right, the next point we have on the forum is the nurse assessor hours update. Danny or Jesse, whoever going to do that, could you remind us what that's about?
Oh, hi, Kurt. This is Erin. I'm going to take this one.
Aaron. Oh yeah, look, thank you, Aaron.
Hi,
You're
hi,
an expert.
everybody. It's good to see you today. I'm going to make a quick announcement about upcoming office hours meetings where it's an opportunity to talk with HICPUF and get questions answered about the skilled care acuity assessment or the nurse assessor. And there are 4 upcoming meetings scheduled. They are on the stakeholder engagement calendar, and we can put the link to that calendar in the chat so you can see where all of the meetings are at and when they're happening, and then you can copy it to your own personal calendar if you'd like. But we've got 4 upcoming meetings that'll happen via Zoom. We've got October 2nd, October 22nd, November 4th, and November 18th. And so if you have any questions, comments, feedback about the nurse assessor or the process, we'd love for you to participate in that. That's the best place to get your questions answered or to provide feedback. So we will be hosting those. I'll put this information in the chat for where you can find the information about each meeting. And then secondarily, everything that we're doing is being posted on the nurse assessor website. So we'll put that in the chat as well, so that if you have questions or if you want to look at previous meetings or agendas, that's where you can go. And I do have one more announcement after this, but any questions about these upcoming meetings for nurse assessor? And I think I see Robin iPhone 2.
Any questions, anyone?
I see a hand raised from Robin iPhone 2. I don't know which Robin it is, but feel free to come off mute if you'd like.
Oh, there we go. Okay, sorry. So what happens, and I know probably in the meetings it'll be clearer. So what happens if you never hear from them, which is my experience? Like they say they're gonna, they're gonna schedule, but then they don't, and then you call them and they tell you they'll call you back and then they don't. So it's been about over 2 weeks now.
Oh, goodness. Okay. If that happens, please reach out to us. My team will put our email inbox in the chat and we will directly request that Telegen contact you, and we'll escalate it with their leadership, because at this point, that shouldn't be happening. So if that's happened to you, or you've put a request in and you're not hearing anything back, we want to make sure that people whose services are at risk, or if there's a timing issue, that we can get you to the head of the line. We can do expedited reviews with Telegen, but we want to make sure that we know, and then we can kind of keep track of how that's going.
Yeah, it's not an emergency yet, but we're definitely moving in that direction.
Well, thank you, Robin. I appreciate hearing that from you.
Okay.
Jessica Fader, I see, has a question here. Will the meetings be longer than 1 hour?
Ooh, good. Hold on. Let me look here. I think so. Each meeting is an hour long, an hour scheduled, and there is a there's a form, I believe, to submit questions in advance if you have any that we can make sure we can get to. So, yeah, at this point, they're all 1 hour long.
Robin, did you have another question? I see your hands raised.
Oh, no, I'm on my phone, so.
Okay, no worries. Okay. Hey, Lauren, I see you raised your hand.
Hey, all. I just wanted to say, like, jump into that. I'm an IHSS agency and have now been on about 5 or 6 of these, and they are scheduled for actually 2 hours. So I just wanted to make sure that's in there. It says in the like invite from virtual that it can be 1 to 3 hours.
My.
Oh, and so let me clarify. Thank you, Lauren. So Lauren's sharing that the nurse assessment is between 1 to 3 hours, depending on the member. We're talking about the meetings, like the meetings that are scheduled are only held for 1 hour at this
Oh,
point in time.
great.
So
Okay.
yeah. Thank you. And I'll just mention I did a couple last week, and they were, one was like an hour and a half and the other one was an hour. So I guess it just really depends on how in-depth your needs are and how much we need to go through. So okay, I know, Kurt, we're really like close to time or at time, and there's a lot of comments in here. I do have one other announcement if I can
Go
share
ahead.
that.
Go ahead, Aaron.
Okay.
Sure, go ahead.
So a secondary meeting, not nurse assessor. We are working on getting it onto the stakeholder calendar right now, but we will be holding a work session to review updates to the HMA or Health Maintenance Activities Documentation Guide. This is a guide that we developed in collaboration with stakeholders several years ago, and there are some updates that are needed. And so we'll have a working session where stakeholders can work with HICPUF staff to try to get that document updated so it's more helpful and address some of the things that like might need more clarity. And that meeting is scheduled for Wednesday, October 15th from 9:30 to 11. As soon as we get it up on the calendar, it'll be available, and it'll also go out a couple of notices via Constant Contact. So if you're interested in helping us make that guide even better, please hold that space on your calendar Wednesday, October 15th. Okay, thank you, Kurt.
All right. The only other thing real quick here is I see that someone asked if this is the last decrease at the time. Is there a decrease to the max rate? I think we talked about that last week. I think it's going to go back down to, I think, what, 57.63 or something like that. Does anyone know?
I believe it's 57.12.
Okay.
Okay,
Any other questions? All right. We are getting close on time. So we are right at 1:23. Our next subject, if we can move on, please, is the work group processing regarding overspending. So, Danny, I'm going to let you head that one up and explain a little bit what we're doing.
Hi. Oh my goodness, I'm jumbling my words and not creating sentences. Thanks, Kurt. Hi, Danny again. So just wanted to do a quick announcement for everybody. I think we brought this up last month, but just wanted to let everyone know that we have some additional details regarding the formulation of a work group where we are going to be going through updated CDAS protocols to include an exception process for members who qualify to exceed the 130% of their CDAS monthly spending budget. This is a result of the recommendation that was made by PDPPC, I think exactly 2 years ago now. Our regulations were updated to allow for an exception to the 130% spending limit. And so we're going to be holding a work group to mostly collect feedback about the updates that we'll be making to the CDAS service utilization review and allocation management protocol for case managers, and then to get stakeholder feedback about the exception process for the members that will qualify. And so this work group is going to consist of 2 meetings. It'll be October 29th from 1 p.m. to 3 p.m. and November 12th from 1 p.m. to 3 p.m. During the meetings, we will discuss the materials and the protocols that have been updated and use feedback to make sure we're not missing anything and that we are aligned with what the recommendation proposed in 2023. The work group is open to CDAS members or authorized representatives, case managers, case management agency staff, our FMS providers, CDAS attendants or direct care workers, if you're interested, advocacy organization representatives, and our training and support contractor. So in the chat, I'm going to provide a link to sign up for the work group. By filling out this form. It is basically you saying, yes, I'm interested. I will be able to attend those 2 meetings, and it will give me your contact information so I can send you materials in advance of the meeting. I believe that's the main update I have. If there's anybody here that is on the phone and doesn't have access to the chat, if you would like to submit your name, or if you'd like to participate in the work group, you can either let us know here and now, or you can email us at hicpuff_pdp@state.co.us, or you can call us at 303-866-5638. But anybody that does have access to the chat and is able to fill out this form, I would ask that you do so that I can keep track of your contact information. Are there any questions right now?
Renee,
Yeah, Renee.
can you send out those numbers that you just gave, or do we gotta try to find someplace to write that all down now if we're don't have access to the chat right now?
Renee, that information will be in the chat notes.
Which will be where?
Which will be either in your mail packet that you receive or the email packet that you receive prior to meetings.
Okay. If I was supposed to receive, you mean like the documents for these meetings?
Mm-hmm.
Yeah, I didn't receive them for today. So I don't know whether they're still on their way, but it's kind of like, I kind of am losing track of how to have access to this information when I'm calling in on the phone. Thanks.
Renee, this is Jessica. The documents that got mailed out for this meeting were a little bit delayed, so they're on their way to you. Apologies for that delay.
Okay, that'll be fine. As long as I get them, so I get that information, that'll be fine. Thanks.
And Renee, I'll just close the loop with you. So the phone number I provided and the email address are the phone number and email address for our team. So when you do get the materials in the mail, or if you have like a previous agenda document, under the reasonable accommodations tab, we have our phone number and email address listed. It's the same contact information. So if you're interested in participating in the work group, just reach out to us via one of those methods and we can get you added.
Which ones are those again?
Yep, under the reasonable accommodations section of the agenda, we have our team email address, which is HCPF, so HCPF_PDP@state.co.us, or you can call us. Our team phone number is 303-866-5638. And that information is on the agenda on page 2 under reasonable accommodations.
Okay, great. Thanks.
Mm-hmm.
All right, everyone. Someone has their hand raised. Is that maybe Renee? The profile says JJBL.
Oh, that's Jim. That's me. That's me. I have a question.
Hey, Jim. Yeah, go for it.
All right, thanks. So, Danny, I'm confused about what this is. So, have you already developed the overspending protocol and you're looking for feedback on it, or are you looking for the group to develop the protocol?
Yeah, that's a great clarifying question. So for context, we already have our CDAS overspending protocol, and we already have the utilization review and allocation management protocol. So those already exist. HCPF has already gotten a lot of feedback, I think, from the group about how the overspending process should exist. And so we're going to go ahead and make the updates to the protocol in-house. And then the purpose of the work group is we'll bring our updates to the group and make sure that they're aligned with with expectations, and make sure that we're not, drastically missing the mark. We will also have some discussions about what additional training might need to be developed for either case managers or members, so that everybody can have an understanding of the new additions that we'll be adding to the respective protocols.
I'm still confused. Are you looking to make changes if you've already got the?
Well, let me do this. Can I speak to that, kind of the whole
Kurt,
background
go
on
ahead.
this?
Mm-hmm.
So 2.5 years ago, I'm going to just say I'm the OG on this. We had some people had some very big allocations because of a lot of health maintenance issues or whatever it happens to be. Because of that, there's a couple of reasons they went over. They had a lot of reserve funds, and everyone realizes it's a use it or lose it, because those funds go away at the end of the fiscal year. So people were having big allocations. Maybe they didn't need it for one reason or the other, or they were saving that for when they had trips planned. The one in particular stuck to my mind was a person had to go to the Mayo Clinic a couple times a year, very high needs person, and needed a couple of caregivers to go with her. Okay. To do that for that amount of time, she would be spending more than her 130% maximum. However, she did have the reserve funds. So the rule come across where people were just spending it because it's a use it or lose it, when in fact there are some people who need that money. It's allocated for those times and they're saving it. So the work group is kind of designed for those times when people actually need to spend more than 130%, what the qualifications are for saving that, and looking at how you notify people and make that happen. So the work group is really designed to say, how are we going to allow people to spend more than 130% based on a reason that they need that? Does that make sense, Jim? Does that make a little more sense?
Yeah, but that's not my question. Thanks, Kurt. That I kind of got that. I think I'm just confused. Why are you you're asking for people to go to this work group if the protocol's already defined, it's already been coordinated. I'm confused what you want and the people in the work group to do. That's all.
Yeah, Jim, I'll clarify that. So we have a protocol for existing policies. So we already have an overspending protocol. We already have
Right.
allocation management. This additional piece, though, isn't in the protocol. So we don't currently have an exception process for exceeding 130%. That information needs to be added to the protocol. Because this has been like a long-term project, HICPUF already has a general idea of what stakeholders are looking for within the protocol. So we're gonna take a stab at updating that protocol prior to the work group. The purpose of the work group, though, is we're going to go over the updates and we're going to go over the new content that's added to the already existing protocol, and that's the feedback that we're hoping to get.
And you're going to make changes to the protocol based on what you get from information from the work group?
That's the plan.
Okay.
If we're able to. I mean, I can't commit without knowing what the feedback is, but if we're able to, we're going to make changes.
Thank you.
Mm-hmm.
Bobby, I see you have your hand raised yet.
I just don't see the form for the work group on the chat.
Let me put it in there real quick, and we can mail and email this out as well.
Got it, Danny.
You got it. Thank you.
Yep, no problem.
Okay, thank you, everyone. Anyone else? And if not, we're getting right at our agenda point here, going to our break room. We did have something on here. Basically, we included a chat overview. We just want to make sure we covered everything, so we added a few minutes in there to make sure everyone gets the information they have, like this work group. Thank you very much for adding that, Amanda. And for anyone who's on looking at those chats, just to share, there is 3 buttons again where there's an option to copy that and paste it. For me, I just copy and paste it into my own email, so I have that information. So just kind of a little hints on how to get that information right away, so you do not have to wait until that information comes out in the next agenda notes. All right. Amanda, do you have anything else? We got anything? It looks like we're doing pretty good here. McKenna, any ideas what we have? Everyone happy in the chat room?
Yeah, the chat is looking good. I think we touched on everything. Minus, I do just want to call out Robin. I'm getting an answer for you, so just hang tight. But otherwise, you look good, Kurt. Thanks.
All right. Well, it's about time then. Let's feel free, everyone, to join your appropriate chat or room that you break out in here. I'll discuss as we need it. So I think we're ready to go to the breakout rooms. Thanks,
Apologies
McKenna.
to jump in. I think we had one more item on the agenda before we get to breakout rooms, and that was a presentation from PPL about their portal.
Oh, I am sorry I missed that. Yes.
No worries. I wasn't showing the actual times on the screen for a minute, so I
Yeah,
wasn't
right. Yeah, I was
prompting.
kind of got to go on my memory here. All right. Sorry there, our folks at PPL. Looking forward to that presentation.
Sure. Hey, thank you. Thanks, Kurt. Thank you, Danny. Yeah, yeah. Today we're just going to have a quick overview of the portal, the Better Online portal that folks use, and I'll hand it over to the guy that's going to be presenting. His name is Kui Lee. So feel free, Kui, to go ahead and tell us what you have.
Real quick, Stan, we made you the co-host, so
Oh,
McKenna, just stand by. McKenna, can you find Kui in the participant list and make him co-host, please?
yeah, he's going to actually be sharing the actual portal demonstration, doing portal views. So I thought it would show up better.
While we're getting Kui up and running, would you like to just give a quick update of are you providing an overview just as general information, or have there been some updates that you'd like existing users to see?
Yeah, there's been several updates. Primarily, we're going to be looking at what the members have available and what they can access, and the information that's available to them as members, and what they can see for the enrollment documents for the attendance. That's one of the primary items that we're going to be covering. And then we'll also be covering what the attendants can also see, and what has been updated for them.
Okay, guys, if everyone can see my screen, the Better Online web portal.
Yes.
Okay, so we're just gonna quick demo logging in as a consumer, as a member, and also as an attendant to show the new dashboard that's there, and also some of the new functionalities that we have as well. The dashboard, once you log in, is gonna go and show the pertinent information from the consumer side that they can see, timesheets and things like that, that they would have access to see immediately off of the dashboard instead of having to click through the different menu options. Come on, plug me in. There we go.
Hi, this is Erin. Do you mind slowing down a little bit? It's a little hard to hear you.
Okay.
And I want to make sure the closed captioning works for folks who need that. Thank you.
I'm sorry about that. Yeah, so this is the members login. When they log in, they're just gonna go immediately to the new member dashboard. The member dashboard will give them access to stuff that they normally do, open timesheets, the employees, the budgets, and things like that. And so it'll show that on the screen. And instead of having to click through the different parts there, they can actually just get through right from the dashboard itself. There's a couple of new icons in the upper right here. There's a notification bell that opens up a screen. Ooh, it won't share correctly. That's all right. But
it's just what we experience.
Yeah, I'm sorry. That's all right. But it's just a screen that's going to pop up, and it's going to show notifications that if there's any that's there. Also, remind this is the test environment. So the data that's shown here is just test data. So don't worry about any PHI or anything like that. The other part right there is the notification, the messaging next to the notification. And again, that's going to have a pop up. That's just going to show a way for you to communicate with PPL to send them information that you're wanting to ask questions or anything like that. Okay. And then the new function that we also have now that we've added into the system is enrollment documents. So that's there on the menu ribbon. And what that does is it gives the consumer and also the provider, which we'll show in a second, access to any of the documents that they've uploaded and that PPL has processed. And it will show the document name itself, the forms associated with that. So any forms that are uploaded and assigned to certain forms, it'll show what they are. And then you'll give the receive date of when that form was received in the system as well. And so you can also organize it by document name or receive dates. And if you have a lot of documents, you also have paging in there. So you have a lot of documents over time, you will have a lot of documents in there. Those will all show up in the system here like that. Okay. I'm gonna do a quick log out and I'll show you the provider side as well. Similar screen.
Wait. So can we slow down a second, please?
Yes, sir.
Does anyone have any questions on this so far? Because I do have one where on those documents, are they fillable PDFs online there, or can we forward them to our employees?
They are whatever format they were when they uploaded. So most faxes are converted to PDF. If they submit to you via email as a document form or as a PDF, it will be that format as well. We don't alter the format type that gets uploaded to the system.
Yeah, these are the filled out documents already, Kurt. These are the ones, once somebody's submitted their documents, then it's saved here to the system.
Oh, I see. So that's kind of basically proof it's been submitted. All right,
Yeah.
appreciate
And
that.
it gives
Thank
you
you.
access. It gives you the ability to go back and if there's a question you had on some documentation that was submitted for either you or an attendant, you can go back and look at it.
Okay. All right. Great. Thank you.
Yeah, and so now we're logged in as the attendant, and the same functionality is there. There's a notifications bell, there's a message, and then again, there's a different amount of data that's there for the dashboard because this is the attendant as opposed to the consumer. The associated members, the pay rates, sick leave details, and then any open timesheets that they have, and then of course contact information as needed. And again, we also have included in the provider side or attendant side the enrollment documents. And again, the same functionality is there. It'll list the documents that was processed, the date was processed. And then, of course, you click on any of them, you see what they are. And as you were asking about, so if I click on the file here, it will download it. So if this is a PDF, it will download as a PDF. And if it's, it'll open up on your computer, whatever applications tied to the PDF itself as well. Most of the files I did for testing, which is PDF, because that's the majority of the faxes that we get in. But again, if they upload a document file and send it as an email or whatever method it was, it will show in that format as well. Most of the time for faxes, like I said, their PDF files are converted. And with some of the other systems that we have, they only come in as a PDF. And mainly the reason for PDF is just that they can't be altered, things like that. And again, the functionality of organizing by date, name, and receive date. So if you have multiple documents, and the names of the documents are where they were when they uploaded into the system as well. So if the person gave it a specific name, or if it's a fax, it will just have a sort of file tag that's put there in a PDF format. Okay, and any questions or any comments?
Yeah, I do. We do want to add in one caveat that we're having a system update this Friday, so any of these changes you're not going to see them yet. Like Quee mentioned, he's showing you what's in the test environment right now. But once we get the system updated this Friday, then these changes will be active and live in the portal starting on Saturday. But on Saturday, we're also doing the rate change update, as Danny referenced earlier, so we'll have some downtime this weekend with that.
All right.
Okay. If that's all, I'll go ahead and stop sharing. Any questions or anything, but like Stan said, this will be out there. And it's just a simple access to the documents and such, so they can have access to it and look through it as they want to. And also the new dashboard that's just puts all the main functions onto the one page that they log in into and see immediately. So they don't have to click through the menu options if they don't want to. Okay, thank you.
So if I understand right, I'm sorry, Jessica, I see your hand up. So these are documents that we submit, like employment applications, so we can review them right on the dashboard there under employment.
You can access them. So
we can access them there.
Yeah, because whatever the format, because it's on your own PC itself or laptop or whatever device that you're accessing it through, and so it's tied to whatever programs associated to PDFs or documents that's on the device that you're accessing it with. So the files itself can be downloaded to your device, and then whatever is tied to that particular format will open with that format.
Okay, great. So it can be corrected or modified as necessary then on that format. All right. Hey, Jess, I see you have your hand raised.
Yeah, thanks, Kurt. Hi, everyone. Jessica Corral here. I'm the contract specialist for participant directed programs. I just wanted to give a little bit more. Thank you first, Kui, for going through that. I wanted to give a little bit more context to this presentation for those who might be new to this meeting. Those who are not new may recall Palco did a similar presentation a little while ago going through the new features of their portal. These features are an aspect of the new contracts that they have that kicked off last fiscal year. So a dashboard, really the intention is making sure that key information is really accessible to folks in an easy to understand way. Kui, if you want to, can you go back to the dashboard just to show a visual? As Kui just went through, having access to completed enrollment docs so that that's always available as a reference. Having a method to contact PPL through the communication, your FMS, in this case PPL. Having a method to communicate directly with them through that chat feature, and various other things. So the goal here is really to make the user experience and the portals both easier and more useful for members, employers, attendants. So I think as you guys interact with their portals, definitely note the things that aren't working well or that you really love even, and provide that feedback to Palco, PPL. Feel free to send it to me or to my unit. We're really looking forward to understanding how you experience these changes.
Outstanding. Anyone else? I just want to share that part of this goes with the surveys that we submit back regarding feedback. So this group and everything is really kind of steered towards our self-direction and programming. So definitely please feel free to share the good and the bad of what you would like to see improved. And we'll keep moving forward with this. So outstanding. I know that was one of my issues is you load documents, it says sent, and there it went into cyberspace and you didn't know if you got it or if it's confirmed or not. So great stuff, you guys. Anyone else out there? I'm doing my best at following the protocol here. I do not see any hands raised. All right. We already talked about chat feedback. We did have a lot more in the chat. I want to ask one more time if we've got the questions answered. And Amanda, we got that handled?
I sure do. Yep, Kurt, we have all questions answered, so we're good to keep going.
All right. Great. All right, so we're just right on time here. We're about 2 minutes early to go into the breakout rooms. Definitely feel free to jump in and in your decided chat room, and we'll see you then on the other side here at about 2:25.
Thank you, Kurt. It's McKenna again. I'm going to be opening up the breakout rooms. So you can find them through your menu. You'll be able to click on the breakout rooms tab. If you need help getting in, or if you're calling in, you'll be able to hang back and I can get you into the right room. So those breakout rooms are open. Feel free to join.
Hey there, welcome back, everyone. I apologize, my Bluetooth died, so we're using my computer microphone. All right, we are ready for any wrap-up meeting notes. Does anyone want to step up? Amanda, I see you have her hand raised right away. Thank you, Amanda. What you got going?
Thanks, Kurt. First, I want to say this new feature in Zoom, McKenna, having you pop into our it felt like, I don't know, just like another voice coming in to speak to us. I wasn't expecting it, but it was a very cool feature. So, but yeah, our IHSS breakout room, we talked a bit about some updates that we're making to the IHSS shared responsibilities form, just to bolster it up a little bit. So we're going to get some feedback. So thank you all so much. And then we also had lots of discussion, just really what people are seeing around service authorizations and getting through our system practices, going through different systems. So really good conversation. So of course, thank you all.
All right. Anyone else? How about the FMS training breakout room?
Yeah, Kurt, I can give a brief update. Our room was pretty uneventful and we came back to the main room early. But we primarily were just getting a little bit of feedback from case management agencies regarding just the administrative rate change process this go around. Kind of the gist of it, how it's impacted their workload and any feedback for the department.
Okay, anyone from our breakout room have any comments you want to throw out there?
Kurt, first of all, you did a great job hosting that. It was good. This is Jim. I think the thing I got out of it was I think Renee had a good point about the nurse assessor program, and she had some questions about how it was going, and that got me to thinking about how maybe for this meeting we should have somebody who's gone through it from our perspective. And Kurt, I think we talked a little bit about this, about what went, what is the best way to prepare, what works from our perspective, and what's a waste of time so people aren't doing things they don't have to do. So in the future meetings, maybe have somebody who's gone through and say, hey, this is where I wasted my time getting ready, and here's what really they needed there, or here's what really worked for them and made things was more effective. That's what I think would be a good topic at this meeting. I don't know, Renee, did I say that right?
You did. I think that user experience of how to advocate when there's a nurse assessor involved in it. Aaron, I did throw out there, and I know you went through it kind of as the protocol to start it all out. So maybe that some others can share that their experiences as they go through the nurse assessor, how it's working and what works and doesn't work.
And Kurt, I'll just add, I just did a bunch of shadowing in the last 2 weeks with the nurse assessors, like sitting in and watching how it goes, in addition to doing a lot of the prep work, but I'm happy to help however would be helpful for this group.
Yeah, Danny, let's make sure to keep that nurse assessor bullet point on the agenda next month. I think we'll continue an ongoing discussion about that, I'm sure. Anyone, anything else? All right. Hey, everyone, thank you for joining. It's been a great meeting, great information back and forth. Continue to join in us and spread the word about it. I think it's a great way that we can keep the word moving and keep things getting better and smoother for all the self-directed programs throughout the area. And definitely next month, I believe next month we have a full 3 hours planned. So any feedback that you have, anything you want to get talked about on the agenda, please feel free to go to the website under PDPPC. You can ask for requests there as agenda item, and certainly feel free to contact or email either Bobby or myself, and we can make sure we get those included as needed as well. So anything else before we call it a meeting, an adjournment? I don't see anything on there. So everyone have a great day. Enjoy this weather coming up in the next few weeks, this next week or so. Be safe. Talk to you later.
Thank you.